everybody, my name is Dr. Meizi from Periohome, and today I would like to show you how I'm doing crown lengthening in the aesthetic zone. In this video, I'm going to reveal my protocol. I'm going to show you two things that I'm using that helps me to facilitate my result, to get a better closure of the wound, and to prevent a papilla loss. I'm using Periokit and cross-link hyaluronic acid in my protocol. So come and join me and let's talk about crown lengthening. Let's get started. Okay, so here I'm using the Cho gauge in order to show how much length I have for crown lengthening. And that you see, the tooth is quite wide, so I can use about 2 millimeters away from the area of the crown. And then I'm marking it with my probe on the tip of the middle of the teeth itself. And then I'm also want to understand if do I need to take out of the tissue or in the papilla sides. And in that case, I need to reduce a little bit in order to expose the root for the crown lengthening. So I'm using 15C blades. I'm taking from the tip of the mark to the mesial side and then to the distal side, and I'm doing the same on the palatal side. I'm using here 69 blade, and after I'm cutting it, I'm doing intracircular incisions as well, and then taking out the remnant tissue with my curette. If I see the tissue doesn't come out, then I can use another incision line. Again, I'm using my curette to take out the tissue and peel out remnant tissue on the roots and on the interproximal side. After I finish this gingivectomy bit, we need to raise a flap. So in that area, I'm going to insert a new blade, 15C blades, and raise up the interproximal side. In that case, I need here to reduce only on the buccal side. So I'm raising both of the interproximal papilla on the mesial and on the distal side. I'm using flap elevator, a very fine one. And I'm raising the tissue. In this area, because we have an implant on the side of the tooth, I'm going to extend my incision also to the area of number 22 and make also vertical incision. Why I'm doing it? In order not to tear this delicate area that surrounds around the implant. Because when you're raising a flap, we don't want to tear. It's preferable to raise the flap and bring back the flap as is. While if you are not doing it, you are risking of tearing the tissue, and then would be a higher problem for us to suture it in the area of the implant. So this is better to do the vertical incision, then later on we will bring it back. So this is the Periokit that I told you about. It's a set of burrs that I specifically developed it for me, but now you can also buy it for yourself. This is a few burrs that helps me to do also crown lengthening and also periodontal regenerative procedures. So what does it do? We have two burrs in a high speed. The length of the burrs is 3 millimeters, so I'm using to mark with the high-speed burr on the bone itself, because now we're doing the vestibuloplastica. So I'm marking 3 dots in the interproximal and also in the area of the edge of the root. This is the mid root in the buccal area, and then I'm actually connecting the 3 dots together. leaving a very fine bone on the root itself, so I won't hurt the root. So you could see I'm connecting the 3 dots. And then I'm using the next burl, which is a fine one, so it doesn't hurt the root, so I can go and actually go with it on the roots itself. Take out the remnant of the bone that was there. Now I want to choose a next burl. It depends on the shape that I would like. There is a flame shape and there is a ball, football shape, and also different kind of diamond grinding. So I'm taking the one that it's, let's say the one it's not so fine, the one that can take out more bone. And you are going, and I'm going through the bone surfaces, as you can see, and reducing the bone thickening. It's very important not to leave such a bone volume, so the tissue can hang over it in a very, let's say, natural way. So now I'm taking the football one, which is the yellow one, because the yellow is very fine. So this is the flame one, sorry, the flame one, and the yellow one is very fine one. So I can go through the root surface itself and reduce the remnants of the bone over there. I also shaping if I see some bone area, root in on the root area areas that are irregular, I also want to make it fine. Then taking my curettes, reducing if there are more remnants of tissue, so I'm reducing it from the surface of the roots, and then I'm going with the next burl and reducing this porch that we have on the adjacent teeth. So you could see there is different kind of shape, different kinds of sizes, and I'm picking the side that helps me to create my procedure perfectly. So this is the football side. And now I'm placing a cross-linked hyaluronic acid, which will help to facilitate the wound healing. As you can see, I'm laying it down, and then I'm all ready to go for my suturing. So here I'm using a resorber suture. It's a 10 millimeter needle. And I'm starting from the buccal area, and I'm going to suture it to the palatal area and bring back the interproximal papilla to its place, because I haven't raised the flap on the palatal side. So the blood supplies is there, and both blood supplies from the buccal to the palatal are now connected again. So the reducing of the papilla side, it will be not occur because we're suturing back again to the same place. And you could see these 3 sutures that I've put on the vertical incision that I had. I'm laying down again the cross-linked hyaluronic acid to reduce scar formation. It was proven in one of our research that it helps to reduce scar formation. And you could see that this vertical incision is sutured, and everything sutures back to the place. So from that area, which there is no crown lengthening, to here that we have a crown lengthening and suturing both of the papilla to the same place. So thank you very much for joining me today, and I hope you enjoyed this video.